Thanks for allowing me to come across the pond to give this keynote lecture. I'd like to thank, of course, Jill and Sarah for their warm reception, also their enthusiasm, which is rather infectious, to say the least. And certainly, I'm really happy that they like the work that I did over the last few months. San Francisco, what a great city. It's my favorite US city. I have to say that I'm here, but it actually is true. It's a beautiful city that I've come to love and cherish. So when they said come to San Francisco, it was hard to decline that offer. I want to take you on a journey through the last 1 or 2 years about what I've been trying to do and my thought process around this area. And Jill's mentioned already the fact that VR seems to be in vogue and taking over a lot of our lives, it seems. When I was flying over the Atlantic Ocean, I was thinking about my first words, and it was actually imagine. So when I actually walked through the bioconvention this morning, it said imagine. I thought, hey, that makes sense. That's exactly what I was thought about doing. So what I want you to do is just think about something and imagine. And imagine this story. Imagine that you're a surgical resident in Tanzania, a country that has a critical shortage of doctors and nurses, lacks resources, lacks transportation and communication. But as a surgeon, you want to better yourself. You want to provide the best care for your patients, improving those standards no matter how you possibly can, despite the limitations. So imagine you're in that situation in a rural hospital in Tanzania. Imagine then you're in Bangladesh. You're a surgeon, again, wanting to improve your standards. Bangladesh has a population of 140 million, ever expanding, difficult, one of the most populous countries in the world, yet doesn't produce enough doctors to maintain a health service. Training is not great, and therefore we think, how do I train myself in this environment? And I have aspirations to be the best surgeon or doctor that I possibly can be. What do I do? Imagine then that you're a senior surgeon in Gaza, of all places. Think about that. Gaza has one of the highest the literacy rates amongst the world, at 98.2%. So people are quite engaged, quite educated, but you're restrained by restrictions politically about how to get out. Imagine you want to train yourself and give 2.3 million people the best treatment you can, but you can't because you're constrained by geography and politics. Imagine that scenario. Imagine then, of course, that you could be a school child, back at 15 years of age, with huge aspirations. You want to practice medicine. You want to study, become a doctor, and perhaps offer society something more different. You could be a great surgeon. You could be a Surgeon General in a few years' time. Imagine that. You have no access, but you'd like to take part, to demystify medicine and be part of this whole process in a city area in London. Imagine then, of course, next, you're a school teacher. You want to do the best for your children, the best for your pupils, give them the best standard of teaching and training. Yet you're restrained or constrained by geography. You'd like to do better. About a month ago, April the 14th, I invited the world into our operating theatre. Okay, we thought about long and hard about doing this. How do we create something that's different, unique? How do we make the world a smaller place? How do we connect people? Which is what I'm trying to achieve with the work that I do. Is the sound up on this one? This 360 camera rig allows immersion. People around the world using low-cost technology, a simple VR headset, can actually immerse themselves in operating theatre around the world. Now, I persuaded my hospital. We're a little bit old. It's 1,000 years old almost, at Bartholomew's Hospital. We've had a history of innovation. I persuaded the hospital to actually embark on a virtual reality program and start innovating, thinking about the future, because we need to make sure we moved ahead. And actually, I persuaded them to part with some cash. A very difficult thing to do for a hospital, right? And actually, they bought 600 headsets for the entire staff to practice and say, look, let's innovate. Let's do something different. Let's teach and train in a virtual world. So that was their own Bart's Health headsets. And I'm glad that Jill's also bought some headsets for you to try out today. We then went about creating an app that was simple. VR in OR it's called. At this point, I'd like you all, if you could, is put your smartphones in, push the app, and have a look at and pretend to be in the operating theatre as we speak. So if you can all get your headsets on with your smartphone and tell me what you think. So this was live in April, and it was a first demonstration of what virtual reality could offer the world. It was the biggest experience we've had so far, and therefore created a lot of discussion, I think, around the whole aspect of virtual reality, or at least 360-degree immersive videos. So imagine that earlier we were discussing those surgeons across the globe. They would like to be trained by other people around the globe and travel instantaneously into the operating theatres or in the hospitals to be trained. This experience you would get through the 360 environment.
And a British surgeon turned an operating room into a global virtual reality experience. The idea is to allow medical students and others to stand in the shoes of an experienced surgeon. It's just the start of more technology making its way into the OR to educate others. This camera hovers high above the operating table at the Royal London Hospital, bringing the images of surgery to places far beyond the OR. It's the world's first operation to be streamed live in 360-degree video via a company called Medical Realities. Dr. Shafi Ahmed hopes it'll transform medical training worldwide.
Well, I think in the past we've done 2D videos, which are readily available. This is going to be 360 immersive. So people around the world using low-cost technology with a Google Cardboard or a headset and a smartphone and app can access live operations and training.
With students all over the whole world watching, the operation begins.
Okay, we're live.
The surgery to remove a tumor in the colon may be routine, but for those watching, it's anything but. Students using VR headsets and smartphones can view in any direction and zoom in on the operating theater as Dr. Ahmed narrates live. They could even ask questions.
I found it really great because I've been in theatres before and it's often really difficult to have a good view of what's going on. So often you're pushed to the background and you can't see anything.
Dr. Ahmed believes this technology, giving others the experience of what it's really like to be in the OR, is just the beginning.
In time, there'll be haptic feedback. You'll be wearing gloves, for example, or bodysuits. You can touch, feel things in the virtual world. And ultimately, imagine a time where you have a virtual surgeon, where you pop into a virtual theatre, you have a virtual patient, virtual instruments, and you do a virtual operation before ever going to the operating theatre fully. And that learning experience will be vital. It's the most immersive simulation that we can think of.
The surgery was a success and
اللحظة اللي احنا نتحدث فيها العملية الآن تجرى في هي واحدة من محاولات كسر حصار غزة. محاولة هي الأولى من نوعها في المجال الطبي، والفضل في ذلك يعود إلى الشبكة العنكبوتية والاختراع الجديد المعروف باسم نظارة هيجو.
It went viral. We're at virtually every news station around the world. Over 400 newspapers carried the article thinking it's the right things forward. I think the narrative seems to help about connecting the world through different technology, about how we make that more affordable and of low cost. So we were in virtually every country. China had the most visits, actually. China understand technology, big, vast country, want to take part in this environment that we live in. I want to push the boundaries as much as possible. And so they're very keen on these ideas. We looked back at the data, of course. It was 55,000 people watched the operation live with me in the VR world. It was 142 countries and 4,000 cities that was part of the experience that we shared. It reached 4.6 million people on Twitter alone, and of course a huge amount of downloads on YouTube. So it seemed the narrative for the world was the right one. They were looking for some stories that were good stories. Health service is always full of poor stories about finance or troubles, etc. This was a good story, so it seemed to fit the narrative from that point of view. I would like to say, of course, that Barack Obama and Angela Merkel watched the operation, but they didn't. But this was obviously a nice little picture that came out recently showing the effects of virtual reality in the political situation. We couldn't get Donald Trump, of course, to put one on. What's the background? Let's go back. There's a huge issue. This is more serious. This is the reason why we've gone down this pathway. The Lancet Commission produced its report last year in April, suggesting that 5 billion people out of a total of 7 billion in the world, do not have access to safe and affordable surgery. These are facts. First time we've quantified the problem with surgical discipline. We spent a lot of time looking at infectious diseases, HIV, TB, malaria, all those things ad nauseum. But surgery was the first time we've quantified the problem. We need about 2.2 million extra surgeons to make healthcare equitable. That equates to almost 150 million operations per year that the world has to somehow deliver to make this healthcare much more fairer. And of course, it will save 16 million lives. This is more lives saved than the whole of treatment of malaria, HIV, TB, etc. It's a much bigger thing. It's huge morbidity and mortality that you can change by changing one dimension in the medical fraternity, which is surgery. These are the areas then that we need to cover to make healthcare more equitable. The red areas obviously are the more important ones to make sure that we deliver healthcare. So how do we do that? How do we provide the solution for this? This has been troubling me for quite some time about, okay, there's the problem, fine, how do we find the solutions? There's many ways of doing it, of course. You can deliver healthcare management, you can make it more efficient, put more resources, but also it's about training, teaching, and improving that workforce. And this is where we scale up and work where technology will help us. Tech companies understand. Google now putting up balloons into the cloud to give high-speed Wi-Fi, those areas that are deficient in internet and access to the World Wide Web. What about Facebook? Well, Project Maria, they're putting down a big cable, not quite through the iceberg, but underneath it most likely, from the eastern border of the US to Spain. This has just been announced last week to increase that connectivity across the globe to allow virtual reality, which is going to be high access, to be much more efficient in the way it works around the world. So the tech comes to understanding how we connect people. When Facebook bought out Oculus Rift a few years ago, they bought out Palmer Luckey for $2.1 billion US. They didn't realize there'd be such a huge demand in lots of headsets coming out constantly, HTC Vive, the Oculus, and many others this year. An explosion of virtual reality this year. Camera companies are making lots of different 360 gadgets now, becoming cheaper and more affordable, where suddenly anybody can create this VR content almost for nothing at all. So people understanding the whole process. We've come a long way, ladies and gentlemen. 1,000 years ago, a chap called Ashwari lived in Andalusia who wrote the first textbook, the first written word for surgery or medicine. It became the embodiment of surgical teaching for 600 years. It was translated to Latin, it's called Liber Theoricae. That's how we trained people before. What about now? Let's have a think. This is the world we live in, 1,000 years later. Our students, our trainees, all part of this world that we live in. We're going to work out how we use this technology and communicate and work out the next method in this evolution of education and training. We've gone through papyrus, paper, we've gone through books and iPads, mobile phones. Augmented reality, virtual reality, and mixed reality is just the next evolutionary stage of the educational platform, in my opinion. And how do we use that? 2 years ago, we decided to use Google Glass, for example, to change the way people were training. We picked up a Google Glass, well, how does it work? Let's do a similar sort of thing that I do with the VR. We did a live operation in May 2014, and we let everybody, student around the world, take part live, and 14,000 were trained across the globe in one sitting. They could text questions into the Google Glass on their mobile phone, on the app, so I could answer them at the same time, interacting with this population. It's a rather unique experience, talking to someone from Australia, then from New Zealand, then from Fiji, then from South America. But it showed me that by simple technology, this could be achieved.
And finally, medical students wanting a surgeon's eye view of an operation are to be helped by some cutting-edge technology. They'll be able to look and learn wherever they are in the world, thanks to new Google glasses.
Seeing through a surgeon's eyes to teach the next generation of doctors. This operation today, a world first. Students watching could type questions, which were projected into the corner of the surgeon's field of vision, so he could answer them while he worked.
Those are the three structures that are commonly at risk during these procedures that one would worry about. So hopefully that answers the question.
The difference here is that any medical student anywhere in the world can log in and learn.
It's the only way that they can learn is by seeing somebody actually doing it rather than reading a book.
So you don't mind that you're going to be broadcast around the world?
No, I've got no qualms at all.
telementoring? Can we train people using this technology from around the world? We use Google Glass now, telementor, using software we developed with Ubisoft AMA to suddenly on your smartphone connect with any surgeon around the world and to train them visually on a mobile phone app, speaking to them directly, communicating and talking. Anthony, can you hear me?
Yeah, I can hear you.
Oh, good. So, have you ligated the vessel?
Yeah, I've taken the vessel.
What's next? Red circle, big no-no. There we are. Okay. And then we save that. Do we need to be physically in the room? What about the future? This is just the first step. Ultimately, simulation requires tactile feedback. We've got 5 senses. We've got to work out how we use them. And actually, companies are now developing tactile feedback. It won't be long before suddenly you'd have a biosensor, you'd have gloves or an outfit, and you can feel in this virtual world. So imagine this concept I sort of thought about 2 years ago called the virtual surgeon, where you can literally create this model that's absolutely virtual, lifelike. You can then put on some outfits, some gloves. You can pick up a scalpel, feel it with your hands, make a cut, feel the cut, operate, have a complication, deal with it. Surely that's simulation we should be thinking about. It's been the ultimate immersive experience. Developing CGI, which is what we're doing at the moment, medical realities, working with companies, developing haptic feedback, etc. It won't be long before, within 2 or 3 years, before this suddenly becomes much more commonplace. You'd all agree, as patients in the future, you'd prefer your surgeons to be trained in the virtual environment prior to entering the operating theatre first and foremost. We can do that, and it will only take a matter of time if this becomes commonplace. When Ray Kurzweil talked about singularity, the law of accelerating returns, he's obviously talking about the fact that at some stage, robots, artificial intelligence, which is the big thing at the moment, of course, with Watson and other computers, supercomputers, working their magic. He talked about computers at some point being more powerful, or at least able as a human being. Okay? I gave a TED talk around surgical singularity. At what point would you trust a robot to become your surgeon? I threw the concept out there. I thought, let's think about it. At what point would you trust a computer to be your surgeon? We drive a car every day, right? We don't question how it was built. Most of it was built by a robot. Yes, you never question that. It's reliable, it's fine. What about clinical skills? What about clinical acumen? What about changing algorithms about how we make a diagnosis, how we treat people, how we deal with things when things go wrong? The communication, could we develop that going forward? I think at some stage we probably will. Surgical singularity, I think, will be with us at some stage. So it was really pleasing that a few weeks ago, just after I did my VR operation, this came out. The first autonomous robot. Okay? First one, managing to put 2 bits of bowel together, to join them together. Okay? Reliably, efficiently. And actually, that robot managed to do it better than a normal surgeon, because doing the same process over and over again. So theoretically, you could replace a surgeon for parts of an operation now, where you may get tired or fatigued, you can have it coming in. So maybe the first part of the surgical singularity will be a part robot, part man. Have a think about that. At what point do we accept the ethics, the legality, the issues around litigation, about a robot doing one of your operations? I think those questions need to be asked, because it's going to happen sooner or later, I'm sure.
Yeah, well, there's a lot of people.
I'd like to thank a few of my patients, first and foremost. These are the patients that have supported me. We're very lucky. We have one of the most enviable health systems in the world, the NHS. It's not perfect. It has problems with funding, and of course we have issues around the resources always. However, we have huge partnerships with our patients. When you're driving technology, new things being done, there's a whole myriad of problems to deal with mitigating risk, for example, legal issues, consent, confidentiality, etc. You need a hospital to support you, like I have at Bart's Health, who don't say to us, don't do this. They say, right, that's what we want to do. How do we make it work? What are the problems? Let's make it work. Let's sort out the problems as we go along. That's really important for a health system to work. Otherwise, nothing changes, and I'll talk about it in a minute. So Roy was the patient who had his cancer operation through Google Glass. James had his operation via the virtuality. And Joan was interesting. She was the first lady I've ever come across who did a full 360 video, and she and her husband wanted to watch the operation afterwards in 360. So she watched her own operation. I thought it's the first time a woman or a man has watched their own operation in the virtual world. She loved it. James, on the right-hand side, when he had the operation, the virtual reality that you've all seen earlier today, I met his family after the operation. And I said to them, how did you feel? I wasn't quite sure what to say to them. His wife watched the whole operation live. I said, how did you feel about that? She said, actually, you know what, it reassured me. Normally when you have an operation, you walk away for 5 hours, we don't know what's going on, no one speaks to us. Here, I can see what was going on, and you're in good hands, etc. So it was a really interesting conversation I had with the family. Two of the sons both watched the operation as well and felt much the same. They were supported by it, which I found really unusual, but still, that's what they told me. So it's unique collaboration with their patients to make this technology work. One of the things that we have to always deal with, and when Daniel Kraft asked me to speak last year at Singularity, I was talking about the dogma and tradition. We're immersed in this in the medical field. It's hard to change things. It's so slow. You have pockets of innovation around the world that do great things. The rest of the world works very slowly. How do you adopt? How do you translate? How do you transform a healthcare system? And you have to challenge dogma and tradition. And that's one thing I've always thought about doing going forward. And this is quite interesting, of course, because when you try and transform technology, try and move things, it takes a bit of risk. A bit of risk on your side, from the hospital and your partners, but if you move down the same path, it's effective. At Bart's Hospital, we're very old, we have lots of famous alumni that I can string a whole load of names. I thought the most pertinent one to discuss today, of course, was James Parkinson, who described back in 1817, almost 200 years ago, his essay on the shaking palsy, the Parkinson's disease, which was then coined by Charcot. Interesting, of course, that when you're moving on, taking a risk, this is where you end up driving. The reason why I put this slide on, of course, is that it'd be a shame to come all the way to the US and not eulogize about one of your greatest sons, a hero to all of us. And actually, it's all very pertinent to this discussion about taking a risk. Thank you very much.